हेलो एवरीवन, वेलकम बैक टू अनदर वीडियो फार्मा रिसर्चर। तो आज मैं डिस्कस करूंगा जीपैट 2015 ईयर का क्वेश्चन पेपर। तो इस क्वेश्चन पेपर में भी टोटल नंबर ऑफ क्वेश्चंस 125 हैं। तो इस पेपर को दो पार्ट में डिस्कस किया जाएगा। फर्स्ट पार्ट में हम इनिशियल 65 क्वेश्चंस डिस्कस करेंगे एंड द रिमेनिंग क्वेश्चंस विल बी डिस्कस्ड इन द नेक्स्ट पार्ट। तो स्टार्ट करते हैं फर्स्ट क्वेश्चन से। So the question is, which type of alkaloid is present in vinca? And the correct answer is option C, indole. Next question is, what is the biological source of Alexandrian senna? And the correct answer is option B, Cassia acutifolia. Next question is, in the following drug, find out the potassium sparing diuretics. And the correct answer is option C, spironolactone. Next question is, how the wetting agent act in the suspension, and the correct answer is option B, reduce contact angle between substance and solvent. Next question is, which phase of suspension is reversible phase, and the correct answer is option B, that is creaming. Next question is, which eye infection is also called as pink eye infection, and the correct answer is option C, conjunctivitis. Next question is, match compounds with the pathway they inhibit. First compound is vancomycin, and it correctly matches with option T, that is cell wall synthesis. For rifampicin, the correct answer is option S, that is RNA synthesis. For puromycin, the correct answer is option number R, that is protein synthesis. And for ciprofloxacin, the correct answer is option number Q, that is DNA synthesis. So option A is correct for this question. नेक्स्ट क्वेश्चन है, ये वाला क्वेश्चन नंबर 8 हम इसमें स्किप करेंगे क्योंकि इसमें रिएक्शन अभी इसमें इन्वॉल्व नहीं है। तो इसके कंटिन्यू नेक्स्ट क्वेश्चन से कंटिन्यू करेंगे अभी। So next question is, what is the 6-methyl derivative of erythromycin? And the correct answer is option A, azithromycin. Next question is, in the diagnosis of myasthenia gravis, only one of the following drugs will be used as a drug of choice. And the correct answer is option D, adrophonium. Next question is, methyl 5-propylthio 1H-benzoimidazole 2-vinyl carbamate is Zeneva name of which of the following drug? And the correct answer is option B, albendazole. Next question is, which of the following is oil of fruit pulp? And the correct answer is option C, olive oil. Next question is, what is true about bioavailability? And the correct answer is option A, that is amount of unbound drug, that is free drug reaching systemic circulation. Next question is, polymorphs in pharmaceutical solids are detected via which technique? And the correct answer is option C, via solid state NMR. Next question is, a series of alpha acyl ureadopenicillins like azlocillin, mezlocillin and piperacillin are superior because of, and the correct answer is option C, improved penetration through the cell envelope. Next question is, Bacillus subtilis is used in assay of which antibiotic? And the correct answer is option D, streptomycin. Next question is, which of the following titrations will always have an equivalence point at a pH more than 7? So the correct answer for this is option C, weak acid with a strong base. Next question is, inadequate drying during coating of tablet leads to which coating defect? And the correct answer for this question is option A, chipping. Next question is, match the crude drug with its biological source. So for the first option, that is Pelcatechu, the correct answer is option number R, that is Uncaria gambier. Next is clove. It correctly matches with option number S, that is Cesium aromaticum. Next is Gorvine. It correctly matches with option Q, that is Symphysis tetragonolova. Next is Hemlock. It correctly matches with option P, that is Conium neculatum. So option C is correct for this question. Next question is, which of the following plot indicates the effects of antagonist on receptor? And the correct answer is option D, skilled plot. Next question is, all of the following statements concerning zero order degradation are true except, and the correct answer is option D, its concentration remains unchanged with respect to time. Next question is, the liquefaction time of cocoa butter of hydrogenated vegetable oil based suppositories is, and the correct answer is option D, 3 to 7 minutes. Next question is, which of the following is most likely to undergo lysis? And the correct answer is option D, a cell with hydrophilic outermost layer in its cell wall. Next question is, match the drugs with the disease for which it is prescribed. First drug, that is bedaquiline, it correctly matches with option S, that is anti-tuberculosis. Sitagliptin, it correctly matches with option P, that is anti-diabetic. For mexiletine, it correctly matches with option number Q, that is antiarrhythmic. And for paroxetine, it correctly matches with option R, that is antidepressant. So correct answer for this is option A. Next question is, which microorganism used in hairy root culture? And the correct answer is option A, that is Agrobacterium rhizoans. Next question is, delayed disintegration in tablet is a result of, and the correct answer is option A, large force of compression. Next question is, match drugs with their receptor that they inhibit. First is 5-HT1A agonist. It correctly matches with option S, that is Vus. For 5-HT3 antagonist, it correctly matches with option R, that is ondansetron. For 5-HT2A antagonist, it correctly matches with option Q, that is ketanserin. For 5-HT4 agonist, it correctly matches with option P, cisapride. So option A is correct for this question. Next question is, passive immunity in newborn babies is due to option A, IgG. Next question is, upper consolute temperature and lower consolute temperature are related to, and the correct answer is option A, CMC temperature. Next question is, compact size low weight mass instrument is, and the correct answer is option B, Meldy quadrupole. Next question is, a pharmaceutical company plans to market a generic version of a drug produced whose patent has expired. Which type of documentation must be submitted to the FDA? So the correct answer for this question is option C, ANDA. Next question is, which of the following does not produce azeotropic mixture with water? And the correct answer for this is option C, propranolol. Next question is, for a particular drug, the rate of absorption but not the extent of the absorption of GIT is affected by presence of food in GIT, then taking the drug with food will result in, and the correct answer for this is option B, smaller maximal plasma drug concentration. Next question is, according to USP, alcohol contains, and the correct answer is option A, 94.9 to 96% ethanol. Next question is, what does it mean that a cell is polyploid? So the correct answer is option B, that is contains more than two copies of a full set of homologous chromosomes. Next question is, amount of dextrose in large volume infusion fluids is, and the correct answer is option A, 5% weight by volume. Next question is, which anthelmintic having immunosuppressant activity? And the correct answer is option B, levamisole. Next question is, choose correct statement for pegylation. And the correct answer is option D, that is all the statements are correct, that is used to enhance in vivo half-life of smaller peptides and proteins, avoidance of reticuloendothelial clearance, and reduce clearance rate through kidney. Next question is, characteristics feature if hemorrhagic dengue fever is, and the correct answer is option A, that is reduction in platelet count. Next question is, the carbonyl stretching frequency for simple aldehydes, ketones, and carboxylic acids is about 1710 cm inverse, whereas the carbonyl stretching frequency for esters is about, and the correct answer is option C, it is about 1750 cm inverse. Next question is, polarographic method of analysis to obtain individual amounts of Ce2 positive and CD2 mixture of the two ions is achieved by measuring their, and the correct answer is option D, that is diffusion currents. Next question is, consider the reaction A plus V to form C reverse. The unit of the thermodynamic equilibrium constant for the reaction is, and the correct answer is option D, it is dimensionless. Next question is, which system does not have orifice to release the drug? And the correct answer is option D, controlled porosity osmotic pump tablet. Next question is, sanguinarine belongs to the subgroup of, and the correct answer is option B, benzyl isoquinolines. Next question is, identify the IUPAC name of dexamethasone, and the correct answer is option B, that is 9 alpha fluoro, 11 beta, 17 alpha, 21 trihydroxy, 16 beta methyl, pregnane 1,4-diene, 320 dione. Next question is, tamoxifen is non-steroidal drug acting at steroid receptor. It produces which type of effects? And the correct answer is option B, that is Q and S, that is anti-estrogen and estrogen. Next question is, which enzyme is used by the HIV to form DNA in the host cell? And the correct answer is option C, reverse. Next question is, sparging is the process where, and the correct answer is option B, an inert gas is bubbled through the solvent reservoir to remove dissolved gases. Next question is, morphine does not cause, and the correct answer is option D, diarrhea. Next question is, which of the following is not recommended in patients with renal insufficiency or cardiac dysfunction? And the correct answer is option D, magnesium hydroxide. Next question is, Higuchi model to drug that is dash in the formulation. And the correct answer is option B, that is dispersed in formulation. Next question is, which of the following is correct about parenteral nutrition? And the correct answer is option A, that is parenteral nutrition solutions are hypertonic solution and IV fluids are isotonic. Next question is, cyclic AMP is an important second messenger in signal transduction pathway. Which enzyme catalyzes the generation or accumulation of CAMP after a receptor ligand interaction? And the correct answer is option D, that is adenylate cyclase. Next question is, which of the following is not included in immunization program as per WHO recommendations for all children? And the correct answer is option A, BCG. Next question is, match the given condition with appropriate drug used for its treatment. First is pernicious anemia, and it correctly matches with option R, that is retrentral vitamin B12. Next is megaloblastic anemia, and it correctly matches with option S, that is folic acid. For anemia associated with chronic renal failure, it correctly matches with option P, that is erythropoietin. For thrombocytopenia due to cancer chemotherapy, it correctly matches with option number Q, that is oprelvecin. So option B is correct for this question. Next question is, in mammals, the major fat in adipose tissue is, and the correct answer is option A, triglyceride. Next question is, polarographic method of analysis to obtain individual amounts of Cu2 positive and Cd2 positive in a given mixture of the two ions is achieved by measuring their, and the correct answer is option D, that is diffusion currents. Next question is, what is the objective of trademark? And the correct answer is option C, to deal with marketplace of expressive ideas. Next question is, turbulent by fluids whose, and the correct answer is option B, whose Reynolds number is greater than 40. Next question is, characteristics of drug protein binding are, and the correct answer is option C, that is all the statements are correct, which includes often parallel drug lipid solubility. Drug plasma albumin binding tends to be relatively non-selective, and acidic drugs bind to albumin while basic drugs bind to glycoproteins. In rheumatoid arthritis patients, increased alpha-1 acidic glycoprotein tends to promote increased lidocaine protein binding. Now next question is, CO stretching are very strong and easily observable bands in IR spectroscopy. However, in the IR spectrum of glucose, CO absorption band is not seen. Why? And the correct answer is option C, that is in glucose hemiacetal group is present. Next question is, what is or are use of phenol coefficient? And the correct answer is option A, that is to compare its killing efficacy to that of phenol. Next question is, arrange the following esters as per decreasing order of rate of saponification. The first one is ethyl benzoate, second is ethyl paramethoxybenzoate, third is ethyl parachlorobenzoate, and fourth is ethyl paranitrobenzoate. And the correct answer is option C, that is number 4 has the highest rate of saponification, then third, then first, and then second. Next question is, which of the following statements about bentonite are correct? So correct statements are P, Q, and that is, glycerin is used to pre-wet the bentonite prior to mixing with water to form its gel. And Q is, aqueous bentonite suspensions retain their viscosity above pH 6 but are precipitated by acids. and MgO increase gel formation while alcohol in significant amounts can precipitate bentonite gel. So option C is correct for this question. Next question is acid insoluble ash of a leaf is called as, and the correct answer is option A, that is silica. सो दैट्स ऑल फॉर टुडेज़ वीडियो। मिलते हैं अगले वीडियो में जिसमें मैं इसके रिमेनिंग क्वेश्चन डिस्कस करूँगा। थैंक यू वेरी मच।